So I'd like to welcome our guest today, Barbara Jordan, who's an indispensable member of the palliative care and hospice care team at Mainline Health at Palliative Memorial Hospital in the Philadelphia area, and also a great friend and supporter of Breastcancer.org. Thank you so much for being here today, Barbara.
Thank you, Dr. Weiss. I am honored to have this opportunity to speak with you. I commend you for the trusted medical information that Breastcancer.org is bringing individuals whose lives have been impacted with breast cancer. I myself was diagnosed with ovarian and uterine cancer and awakened in the wee hours of the morning, unable to sleep, felt my heart pounding in my chest before I learned the results of each and every checkup. Gone through surgery, chemo, and radiation therapy, and worried about my family if I don't beat back this disease. By way of my personal background, I am closely involved with Penn Medicine, that is some of the greatest scientists, researchers, and clinicians in the country who focus our energy and life's work on understanding and hopefully discovering ways to treat our individual cancers, to cure or to give us a longer time horizon. For the past 9 years, I have been a palliative care volunteer for one of the mainline health system hospitals, where we provide excellent medical care to the community each and every day. The extraordinary nurses, doctors, and medical personnel treat patients with life-threatening illnesses with care, compassion, and an intuitive ear to hearing the needs, fears, and goals of each individual. The palliative care team discusses with patients and their family members their diagnosis and what matters most to them right now and in the immediate future so they can improve their quality of life.
Wow, it's really remarkable. I mean, what that team does. I mean, it's such a talented group of people that you get to work with, and there are these teams of incredibly dedicated and devoted people with talent. Most hospitals have this resource available to the patients that they care for, yet many patients don't even know about it. This is a really difficult time in the lives of people around the world, including the patients that we take care of together in our own backyard, particularly because of the COVID19 pandemic. How do you feel that the pandemic has impacted those patients who seek care from the palliative care and the hospice care teams?
The coronavirus, or COVID-19, has virtually turned our medical world upside down. Those of you diagnosed with metastatic breast cancer have already had your world turned upside down. You've been making tough decisions about treatment options and are in the process of researching doctors, institutions, trials, medications, and time horizons. You had a plan, and now restrictions imposed by the pandemic force changes in your treatment plan and increase your worries further about your health. As we engage in this journey to defeat your cancer or prolong the time you have here with loved ones, we push off the thought of planning for our own death, whether it's 1 day, 1 month, 1 year, or simply decades. We mortal humans, even without the presence of a serious illness, deny the reality that we will all die one day. So we don't talk with those we trust and love. We don't acknowledge this reality. And most of us don't make a plan for ourselves or for our loved ones to follow if we're no longer capable of making our own decisions. One of our most important plans for everyone, with or without a serious illness, is to share how we want to write this last chapter of our lives for whenever the end of life happens.
Wow, no doubt. This is a really tricky subject and hard to talk about. It's not like we get training to talk about, the end of our lives in the same way that we would talk about something else that's, that may be even a lot less important, right? I mean, this is a really important topic. And when we, why do you think people avoid this topic, and how do you, as a professional in this arena, sort of introduce this subject and get people to sort of be open to considering what they might want, what they might not want, and how to begin the conversation?
Well, it's interesting. Death is such a natural part of life. But as I said, most of us don't plan for it. And it may be a variety of issues. It may be fear of the unknown, the loss, the finality of life on earth makes us deny it, avoid speaking of it. Although we all know without a doubt that death is going to occur to each of us at some point in the future. The fact of death is unsettling. And we're taught to give birth, and only now, recently, are we beginning to teach how to die and what that means to each of us. We excitedly look forward to a birth, but despite even deep religious beliefs, many fear death, and yet both are such a natural part of the life cycle. Two programs that can be instrumental when faced with a serious or life-threatening illness are palliative care and hospice.
Yeah, they two critically important areas of the care we can provide to patients. Can you explain though further what palliative care is, what hospice care is, and how they're different from each other?
Sure. Palliative care is a less well-known program because it only became an approved medical specialty in 2007. Palliative care's goal is to improve the quality of life for the patient. It is appropriate care for anyone at any age and at any stage of a serious illness, and can be offered together with curative treatment aimed at curing a disease. It typically gives patients and families the highest quality of life for the longest time possible. You can sign off palliative care whenever you want. This type of medical care focuses on providing patients with relief from the stresses of a serious illness and the symptoms of pain, shortness of breath, fatigue, constipation, nausea, loss of appetite, difficulty sleeping, to name a few. By utilizing close communication between the patient, their medical team, and spiritualists, an extra layer of social, psychological, and spiritual support is there for the patient and the family. Interestingly, in 2012, a randomized study at the Massachusetts General Hospital of 151 patients with metastatic lung cancer found those who received early palliative care scored significantly higher on quality of life measures from those receiving standard care, and they were also less likely to suffer from depression. These patients more frequently declined aggressive end-of-life treatment, like chemotherapy in the final weeks. However, they still survived several months longer. Other studies have shown similar benefits, including better symptom relief, less time in intensive care units, and greater satisfaction with their care and higher spiritual being.
Well, it's so important. And, it's not like we get that special, magical opportunity to connect with people who are really dedicated to the quality of life, particularly during a challenge like cancer. And it's a true gift. And I know a lot of people who consider palliative care wonder, like, how long can you be on it? Can you be on it as long as you need it, as long as you require symptoms? Let's say you've got ongoing pain. Can you be on it as long as you need management or support while you're experiencing that problem?
The answer is yes. The multidisciplinary team that works to provide medical, social, emotional, and practical support help to determine whether continuing palliative care is appropriate or if it is time for hospice to be discussed. There may be costs associated with the palliative care team. Medicaid, Medicare, and insurance policies may cover these expenses, and veterans may qualify through the Department of Veteran Affairs. Hospice, on the other hand, is a more familiar program. Hospice is a way of caring for those individuals with a likelihood that they have 6 months or less to live, and who have determined that they want to stop all aggressive medical treatment to try to cure their disease. Instead, they are choosing what we call comfort care, the management of symptoms, spending their days as they choose, and frequently the choice to die at home. One of the differences between palliative care and hospice is that you have to medically qualify for hospice. However, as palliative care, if you start hospice and realize it is not for you, you can quit. Signing up does not mean giving up all medical care, as therapists that improve symptoms and provide comfort are priorities.
Wow, it's so important to know. So how do you qualify for hospice? Like what are the criteria that you need to meet in order to qualify for hospice?
Patients have been diagnosed with a life-limiting condition with a prognosis of 6 months or less if their disease follows its normal course. Progressive weight loss, increasing weakness, fatigue, and sleepiness, deteriorating mental functions, recurrent infections, and an overall decline in their condition all qualify people for hospice. There is a common misconception that when a patient chooses hospice, they die within days. The patient may well die within days, but that is due to their medical condition, not to going on hospice. Importantly, hospice is not about hastening death, but recognizing that someone has a limited life expectancy. They are now choosing how they want to live their last days or months, focusing on what matters most to them and on the people who are most important to them. It has been scientifically documented that patients actually live longer with a better quality of life when they take advantage of hospice sooner than later and of all that hospice has to offer.
Well, it makes sense that when you're feeling supported and listened to and attended to and cared for, that you're going to feel better and you're going to likely live longer. Why do you think that people live longer when they actually benefit from hospice care?
It seems that a patient that has decided to go on hospice can let go of some of their worry and guilt about the toll their illness is taking on their family and caretakers. And they're relieved by also turning over their care to the professional hospice team. The team consists of social workers, nurses, physical therapists, volunteers to help with light home chores twice a week, spiritual persons. They're medical personnel who are available 24 hours a day, 7 days a week, to talk on the phone or to come to the home to see the patient, which brings support and reassurance to the family. Medicare covers 100% of all expenses for hospice. Wheelchairs, commodes, hospital beds, and walkers, so financial burdens are lessened. In addition, and very important, the family is timed to be just that, family, giving the dignity for personal care to the hospice nurse.
Wow. I mean, that level of care, especially in the home where you want to be, is so precious, and it's indispensable. And it's really, it's indispensable to the individual who's closer to the end of life than she previously was, and also to her family that's been sort of surrounding her, trying to figure out, like, how can we be helpful at this time? It's not like people know what to do. And here's this team of people that this is their whole profession. This is their whole focus. They know so much about this really important time of life. Because of course, as you pointed out, it's part of life's continuum. It's part of what the ebbs and flows are. And even if you sign up for hospice because you think you might be within 6 months of the end of your life, a lot of people actually live longer than 6 months, and that's fine. And people can get on and off hospice. I know someone who was on hospice 3 times before she actually passed away, and had the ability to start it and stop it. So I think it's one of this critical part of care that people look at and are really interested in exploring, but maybe afraid to sort of step over step over into that world and sign up for it. So it's really such an important part of care that I'm so glad we're getting more clarity and understanding about what's involved. People often ask me, what is the difference between palliative care and hospice care, as they're both so intimately involved with people who are critically ill? And it doesn't have to be people who are, have got metastatic disease at the end. As you said, it could be people who are just suffering from side effects of cancer itself or the treatments. So can you give us a better understanding of the difference between palliative care and hospice, and how you approach the transition possibly from palliative care over into hospice?
Sure. Both palliative care and hospice work to ensure that patients and their loved ones get the very best treatment and care in their final days and months, and perhaps years, by managing the symptoms, supporting decisions, offering comfort, and when needed, pain management. The biggest difference between the two is that a patient receiving palliative care can still receive proactive curative treatments for their disease, while also receiving professional guidance, decision-making support for all involved with their medical treatment. Patients choosing hospice have decided they no longer want aggressive medical treatment, and they want to turn to getting comfort care, where a team of healthcare professionals manage all of their symptoms, such as pain, breathing difficulties, confusion, and anxiety, while at the same time providing support for the family.
That's so important. And people, it's important for people to know that they can explore this area of indispensable care one step at a time, that they would first speak to an expert in that arena to find out what the services are, what your needs are, to try to see if this is the right time to initiate the care of palliative care, the palliative care team, and then to step into the various services that are provided, because there's everything really from nursing to pain management to symptomatic management that you discussed before, as assistance at home, respite for family, help with medications, just basically understanding what is it that you're feeling and what might be solutions to help with it. And that decision to support that you described is one of those things that is so important, because there are a lot of decisions to make, right? There are little decisions and big decisions, but they're all feel important. And so to have someone who's experienced in that arena help you make some of those tricky decisions that you can live with and feel comfortable with is such a relief, and such a source of support that people really need at that point of life. It's really important to know that you can step into it in an incremental way. But of course, the decision to stop curative therapies and start hospice, that is a more serious conversation.
It is. I think one of the important things to think about with both programs is that it is a way for the medical team that the patient is involved with to really wrap their arms around their patient and support the patient and the family in its entirety. So as they go through making all the medical decisions and the decision whether or not to go on palliative care or hospice, these are hard decisions, and they're important decisions for everybody involved. But one of the greatest benefits is clearly knowing your team is on your side, and they're going to listen to you, and they're going to make whatever decision you decide upon as good as possible. 40% of palliative care patients do reach a point where they no longer need this care. And that could be that some of the patients transition over time from palliative care to hospice. This usually happens following several repeat admissions to the hospital over a relatively short period of time. And again, when the patient-physician partnership determines that there are no more effective medical options available to treat the disease. So at this point, the conversation that we humans frequently avoid, the topic of death and dying and aggressive medical treatment, comes to the forefront. Many deaths are preceded by a surge of treatments in the last week of life. All along the way, people are going from one treatment to another, hoping for a miracle at least a few more weeks or months of life. We've become accustomed to that way of thinking. What's next? What's next? And it makes many of us keep trying the next treatment and then the next treatment, even when the chance of benefit is low and the side effects can be troublesome. As a matter of fact, about 13% of Americans with terminal cancer receive chemotherapy in their final 2 weeks of life. Another complex part of the decision-making is that the patient decides to continue treatments just so they are not perceived that they are giving up and disappointing their loved ones, or for that matter, their physician. It is sometimes hard for those of us who are not critically ill to understand that there does indeed come a time when a patient has worked as hard as they can to fight the cancer and are just plain exhausted from the hard work, the pain, the emotional and psychological toll, and that the mountain has just become too hard to climb any further. Over the past several decades, we've witnessed some extraordinary advances in medicine, leading us to have unrealistic expectations of modern medicine's power to prolong life regardless of a patient's age, diagnosis, and complicating medical factors. Unfortunately, this is not true for all cancers. Many patients' hopes rest with the newest drug, being enrolled when possible to the latest trial, and using every piece of medical knowledge and skill that their doctors have learned in their years of treating patients. Fortunately, healthcare providers are recognizing the benefits of palliative care and hospice, which has opened new doors for an additional way for the medical profession to treat their patients. Hopefully, public education and engagement on all levels, society, community, and individual, will increasingly bring these choices to patients and their families. This would be good. And so I'm going to conclude. I am so proud to have been a part of Breastcancer.org from the very beginning to fulfill its critical mission, and to have the chance today to share the palliative care and hospice program with the Breastcancer.org community. Thank you.
Thank you so much, Barbara. This was really so helpful, and I know that your words, your empathy, your sensitivity, that they can feel it, and it's because of who you are. It's also you've lived a very rich life, and you've experienced this part of life through your loved ones, and being a cancer survivor. I'm a cancer survivor. When you get in those shoes, you're kind of forced to think about uncomfortable thoughts because of just as you manage all the fears that race through your mind and that are both real and ones that we amplify. And it's always good to handle those with real information, with people who are dedicated to taking care of people in these situations. And that palliative care and hospice care really are gifts to those of us who are dealing with cancer and the complications from it, including when cancer progresses and we find ourselves at the end of life, that we don't have a guide. We don't know how to do it. And it's so important to know that there's a path forward, and that we can explore this step by step and have these conversations sooner than we might want to have, these conversations, and not just have them in our own mind, but also share those thoughts or conversations with people you love, because they really want to know from you what your preferences are, what you're thinking, what your wishes are. And it doesn't have to be like, you don't have to come up with like a draft, a final declaration of what you want. It's a conversation that is going to evolve over time, and you may shift your thinking and add to it or take away from what you expressed, what you write down and share with your family. But both of us agree that it's good to start this conversation, even if you're fully well right now, just so that people who love you know what you would hope for. And you also want to find out from the people that you have in your life what they hope for, because you never know. It gives you a freedom, or when you have these conversations, you feel somewhat unburdened by shedding some of the fear and the anxiety about it, and instead feeling that your wishes have been heard and respected. So thank you so much for being with us today.
Thank you.